Hi, Tom. This is Tom Ambrose. Hi, Tom.
Hi there, Janine.
Hi, Tom. If you would just tell us about what brought you to our office.
Okay, I don't mind telling you that my happening coming to the Johnson Chiropractic Clinic has been somewhat of a quirk. We were up in the area and my wife came across an ad that they had placed in the paper, in the Manistee paper. And what intrigued us about that was the fact that I do have a thyroid problem, an underproducing thyroid. In fact, it's called Hashitmoto's disease. And it's one of the things she mentioned in there was the disease itself. And that maybe the cause of that might not be related strictly to the thyroid. I also have a problem with B12, pernicious anemia. Therefore, I don't retain B12 orally, so I have to take shots to solve that problem. In any event, they're related indirectly some way or another. Now, what happened after we looked at the ad, we made an appointment to come up here to the clinic. And I will say one thing. Let me preface this by saying that I had been to Mayo Clinic, spent 2 trips up there, spent a couple of trips to University of Michigan Hospital also. And the only result I got out of them was a diagnosis telling me that I am old, which was really a surprise to me because I didn't know I was. That's a little tongue-in-cheek humor for you. The fact is, I played senior softball and have played for a lot of years. So therefore I play ball with a lot of fellas that are my age. And my reply to them telling me that I am old kind of stunned me because I play ball with a lot of fellas that are my age. They don't have the problem. So I'm trying to figure out why age would be the factor in my problem, causing my problem when it isn't causing any problem to them. So in any event, getting back to why I came to the clinic, that's one of the reasons. We came here, and I will say one thing, that after spending a couple of trips up here, Dr. Johnson has made me go through a few tests that these other people haven't even come close to having me do. And indirectly, whether those tests were the result of some of the progress that I've made or not, I won't say for sure, but I will say one thing, that I feel as though we're making some progress in my overall condition. Now let me explain my condition. First of all, it's an equilibrium problem. Now when you mention equilibrium, the first thing that comes to mind with a lot of people is that they want you, will tell you that you probably have an inner ear problem, Meniere's disease, or something of that nature. Now with Meniere's disease or an inner ear problem, a couple of things that you will automatically look for, and some of their symptoms are nausea, room spinning, the inability to walk directly, and you will have buzzing in your ears. Now this can happen whether you're sitting, standing, or laying down. In my case, sitting, standing, or laying down, I don't know I've got a problem until I start moving. So my problem is triggered by movement, which would kind of eliminate the inner ear thing automatically. But for some reason they all seem to want to lay on that factor. But after being here for, well, let's see, I've been coming here a couple of 3 months, we have pretty much eliminated that as being a reason why I'm having this problem, because when I move, that triggers the inability to walk straight. My feet and my head don't want to work together. This has affected my ball playing by all means. Now, everyday life is not affected because I can get through my everyday life without any problems at all. Other than the fact that the occasional, maybe a little stumble or walking, bouncing off a wall here or there. But I don't get dizzy. So, in any event, Dr. Johnson has come up with these other tests that I should undergo and have come up with the fact that possibly maybe I might be having some problems with gluten in my diet is one thing, and some other tests that she would figure that she could help me out with in the chiropractic end of it, and which she has. And I will say one thing, in the short time that I have been here, I've gotten to a point where I have made more progress, gotten better results from what she has suggested and that I go through. And so therefore, at this stage of the game, I'm completely happy. Since I've been coming here, I'm not completely, shall we say, cured of the problem that I am facing. But I will say one thing, that I'm 500 to 1,000% better than I was when I first came in here. I'm walking straighter. I'm getting some adjustments in the lower back, but none of these other people even came close to suggesting that I do. And with some of the other problems that other tests that she has me undergo. So at this stage of the game, I want to say one thing. I'm thoroughly happy with my ability to come here and the fact that I have made this contact with Dr. Johnson. My suggestion is to anybody else, give her a shot. You can't lose a thing. Thank you.
Awesome. Thanks. Thank you, Tom.